Okay, we'll get started. Thank you so much for joining us today. Hello, everyone, and welcome to our Public Assistance Benefits Information Session. And this is intended to help anyone who would like to learn more about the resources and eligibility for some amazing programs. So we're so happy you could join us today. My name is Sue Parks. I'm the President and CEO of Orange County United Way. And in case you're not familiar with our work, we focus on programs that improve educational outcomes, help people bring financial stability to their lives, secure housing, and we do our best to help children lead healthier lives here in Orange County. So today we're excited to collaborate with the County of Orange Social Services Agency to bring you this informational session on public assistance benefits. And we are so grateful to collaborate with them, and we're happy that our experts, Amber Nowak and Yolanda de Avila at SSA, have agreed to join us today to talk about the many public assistance benefits that families can obtain, food, healthcare, employment, and more during these difficult times. Today, our speakers are going to share with us information on CalWORKS, CalFresh, Medi-Cal, general relief, and emergency child care. And they're going to provide information on what each program offers, who is eligible, how to enroll, and hopefully debunk some of the common misconceptions. And while our presenters will provide instructions on how to access these different benefits, I also want to mention 211 Orange County. That's a hotline that's always available as a starting point for people seeking general assistance. Just dial 211 to get connected, and they can refer you to services that can help you with basic needs. And with that, I'm going to turn it over to our first presenter from Social Services, Amber Nowak. Amber, take it away.
All right. Thank you, Sue, and thank you for having us today. My name is Amber Nowak, and I am with Family Self-Sufficiency Division under the Policy and Quality Assurance team. And I will be going over some general information and then sharing with you about CalWORKS and emergency childcare. Next, please. Next. And next. Okay, so this is our vision and our mission. And at SSA, we strive to help create a community that is safe, supportive, and promotes self-sufficiency. Simply put, our mission is to deliver quality and responsive services that help Orange County residents. Next. Under the leadership and guidance of the Orange County Board of Supervisors, SSA is the largest agency in the County of Orange with over 4,300 employees and about 20 office locations countywide. You can see from the slide that our residence assistants and our county number of positions authorized and our operating budget. And if you look at the sum of our programs, we serve over 1 in 4 Orange County residents. Of that, you can see the breakdown by population segments. So 2 out of 5 children, 1 out of 5 adults, and 1 out of 6 seniors. And our approved budget for fiscal year 2019-2020 is close to $920 million. And next, please. So our CalWORKS program, which is also referred to as the Temporary Assistance for Needy Families, or TANF, is a cash aid program for low-income families to help meet basic needs. And it provides education, employment, and training programs to help families get jobs and move towards self-sufficiency. So these benefits are delivered via electronic benefits transfer monthly. And adults are eligible for 48 months, and children may receive cash aid until they turn 18. And we do use every discretion to make sure that information is confidential and not disclosed unless necessary, usually for verifications. And next, please. So who is eligible? So in order to be eligible for CalWORKS, you must be a U.S. citizen or legal resident and reside in California. There is property limit guidelines, so it's $10,000 for all households or $15,000 for households with a member age 60 and older. And these were recently revised as of June 1st. Prior to June 1st, it was $2,500 for all households and $3,500 for households with a member age 60 or older. So this is a huge jump and allows for a lot more individuals to be eligible due to the property increase. And all CalWORKS eligible must have children in the home who are deprived of parental support or care because of absence, disability, underemployment, or death, or be a needy caretaker relative of a foster child. And we do have a resource coach that can help someone apply, or the individual and family may apply online at www.mybenefitscalwin.org. Some more information that I wanted to provide in regards to this is income eligibility is based on the assistance unit size and eligible income, in addition to the property limits and the residence requirements that are listed on the slide. So assistance units can include parents, spouses, children who are siblings, half-siblings, or step-siblings to the applicant or recipient. And some of these are mandatory to be included, others are optional. So it's really important to either talk with someone or go on MyBenefitsCalwin.org in order to see what your eligibility would be depending on your household size. And we always evaluate the children first and then the relationship of the other family members to the children. Income that's counted for the CalWORKS program can include but is not limited to disability, salary and wages, commissions, unemployment benefits, Social Security, retirement, or survivor's benefits. And there are several factors that are taken into account when calculating the income. So it's best to have the staff calculate it or go on to the MyBenefitsCalwin to see if you're eligible by filling out the information. And it's really easy, the MyBenefitsCalwin, you go on there, you put in some basic information and it can tell you immediately, what your eligibility is. And then we did have some questions about undocumented individuals. So undocumented individuals are not eligible for state or federally funded benefits. However, if they have a child that was born in the US, they may be eligible to receive the benefits. So the parent wouldn't be eligible for benefits, but the child can receive benefits because of them being born in the US. And I did want to mention that besides the MyBenefitsCalwin, we are in phase 1 of our reopening of our offices as of Monday, June 22nd. But we still really encourage everyone to go onto the MyBenefitsCalwin just because, it's easier, it's more accessible. Our offices are limited in functionality and in office hours. So that is the easiest way to go on and see what you're eligible for. We also have a call center that can be reached at 1-800-281-9799. So you can either go on to mybenefitscalwin.org or you can call the call center. And again, that number is 1-800-281-9799. Next, please. Okay, our Welfare to Work program is provided with supportive services to remove barriers to employment. So all adult recipients and children 16 to 18 who are not in school are required to participate in welfare to work unless otherwise exempt. And when they participate in this program, they are eligible to receive supportive services, which can include childcare, in order to participate in approved welfare to work activities and or to obtain and or retain employment. You can receive transportation in assistance, which can include mileage or a bus pass. And we also have what is called ancillary funding. So that's available to participants for certain necessary expenses in order to help them participate and be successful in their welfare to work assignment. So some of those things that can be paid for with ancillary funding can be clothing needed for work, books for school or training, school fees that are not including tuition, tools. So if you are going to work as an electrician or a plumber and you need tools in order to do that, ancillary funding can be used for those types of things. And then we also offer diaper assistance payments to families with eligible children. In addition to this, for our welfare to work program recipients or participants, homeless assistance is available. So I wanted to mention that because we did receive some questions regarding homeless assistance. And we have two types of homeless assistance. We have temporary homeless assistance, in which CalWORKS families can get up to 16 consecutive days for shelter costs if the assistance unit has no place to stay while looking for a permanent place to live. And then we also have permanent homeless assistance. And there's two types of permanent homeless assistance that are available to CalWORKS families. There's an issuance to help pay for costs of securing a new permanent residence if the assistance unit has no fixed or regular nighttime residence, or there's an issuance to prevent eviction when the assistance unit is given a pay rent or quit notice for non-payment of rent due to a financial hardship situation resulting from circumstances beyond their control. Okay, and next, please. Next is emergency childcare. And this flyer was created by Children's Home Society, who is running the emergency childcare program right now. And this gives all of the eligibility requirements. It gives the contact information for Children's Home Society and their hours. And I did want to mention that it does state on here that families are eligible to receive emergency childcare services through June 30th. But we did receive information from California Department of Education that services can be extended. So if you go to the next slide, next please. If you apply before June 30th, which I know is just in a few days, you can receive funding for 60 calendar days from the date of enrollment or until June 30th, whichever is longer, subject to available funds. So families must enroll by June 30th, but then they can receive childcare for up to 60 days after their enrollment. And again, this is a change to the original directive that services would only be received through June 30th. So it is possible that families may receive care up until August with this funding. So this funding is available to all essential and emergency workers. The application process is done through Children's Home Society of California, and the website is located on the slide, which is www.chs-ca.org. And on that homepage, there is the funding information, and you can also go on there to look for childcare providers, because they also are the resource and referral for Orange County. So you can go on there and look for childcare providers in your area as well. So in addition to Children's Home Society, we have created a link to a database of open and available childcare providers in Orange County. So what happened was when COVID-19 hit, a few of us throughout the county came together and developed the Emergency Child Care Task Force. And this was developed because people were finding it really hard to find open and available childcare providers because everybody was closing. So in response to that, we created this website. It's updated every Friday with open and available childcare providers, and it's very easy to use. It's basically like a spreadsheet that has all the different centers and homes that are open and available. And so you can go to that website as well to look for childcare providers. And there's also a third site that was developed through the state, and this is for statewide childcare, and that is a little more comprehensive. It has information on licensing, capacity, and open spots. So the two sites that are listed on here are just for Orange County, but the site that I'm going to give you right now is throughout the state of California, and that website is mychildcare.ca.gov. And again, that's mychildcare, mychildcare.ca.gov. And you can type in your address and it will bring up all the different child cares in the area, and again, give information on licensing. So when was the last time they had a licensing report, what is their capacity, and if they have open slots. So it's a little more comprehensive if you want some more information. And then in addition to this, I wanted to mention that for those who do not fit the emergency child care criteria, subsidized childcare may still be available to those who qualify based on income and family size. If you're going to work, going to school, looking for work, and there may be some other needs that qualify you for childcare. So through Children's Home Society, there is additional subsidy programs that may be available to families. And childcare is available for children 0 to 12 years old. The parents select the providers, which is the same with the emergency childcare. You would select your provider that fits your needs, and this could be a licensed center such as a kinder care or child development center, a licensed home, or a family, friend, and neighbor if that is who you want to watch your child. So both of the emergency childcare and the other subsidized programs allow you to pick your own provider based upon the family's need. And the subsidized childcare programs are available to undocumented parents. So I wanted to mention that because there was a lot of questions regarding undocumented individuals. And so for the subsidized childcare program, undocumented individuals would be eligible for those childcare programs. And you can contact Children's Home Society to find out more, or you can apply on the website that's on the slide, the chs-ca.org, and click on apply for childcare assistance if you're interested in applying for childcare. And like I said, you can also look for childcare providers as well. And I think that's it for me. So now I'll pass it to Yolanda de Avila to discuss general relief. Thank you.
Hello, everybody. I'm here to discuss the general relief, and here's some background. Cash assistance, it's a cash assistance program funded by the County of Orange, and the state law provides basic guidelines for the program, but each county is allowed to develop their own eligibility standards and requirements, which are approved by the Board of Supervisors. So this means that every county has their own regulations, and they're based on their county's Board of Supervisors and the standards and requirements that they have for each individual county. This program provides temporary cash aid to eligible indigent adults with no minor children. So this is the opposite to what Amber was presenting, because Amber was presenting the program that is for families with children. General relief is considered a loan and must be repaid. You must be a U.S. citizen or legal immigrant who resides in Orange County to receive this benefit. Next. Here's some eligibility information. The eligibility is determined by an eligibility technician. Legal immigrants may receive benefits only when they do not qualify for federal or state-funded cash programs such as SSI or CAPI. All people must meet income and property guidelines. And the eligibility factors are income, liquid assets. So we look at your resources, bank accounts, vehicles, and then we look at the economic unit composition, who's in your household, and then the living arrangements, who do you live with? And then, are you an Orange County resident? How long have you been an Orange County resident? Citizenship and legal status, or your legal status. Next. General relief has, if you will, two categories. The first one is for individuals who are physically and mentally capable of working. They're listed as employable individuals, and their GR benefits are limited to 90 days in a 12-month period. Employable individuals must register with the General Relief Work Program and cooperate with all requirements. So that is mandatory. If they don't cooperate with all of the requirements, they will not be approved for the GR program. And so again, I need to reiterate that it is limited to a 90-day period within a 12-month. So it's 90 days in a 12-month period. The second category are individuals who are unable to participate in our General Relief Work Program due to a mental and or physical disability that is permanent or expected to last for 12 months or longer. May be referred to our partner public consulting group through the SSI Advocacy Program. We had a question regarding this. The question was, how long can individuals receive general relief if they are deemed disabled? So I wanted to clarify, if they're deemed disabled, they typically are then eligible to federal or state programs. And so this is really an interim phase where they haven't been necessarily deemed disabled per se, but they are experiencing a mental and or physical disability that is expected to last 12 months or longer. So per medical report from a doctor, they are not able to work for, in this case. So they would be eligible to general relief. However, as we mentioned here, when they are referred to our on-site partner through the SSI Advocacy Program, the goal is to be able to guide them to the next step, which is to be financially stable through SSI or through whatever other program that they're entitled to, SSDI, anything else that they could qualify for, assuming that they meet all the requirements for GR. Next. So as a result of the COVID virus, we're taking extra precautions for the protection of our clients and staff. We closed our offices March 17th, and we did experience some reopening of offices just this week. It is phase 1. It's very limited, and they have other phases planned, but it is all dependent on it's very fluid because it's dependent on the changes that happen in the future, if we end up peaking, if we have another stay-at-home order. So at this time, we have other methods for customers or people that are looking to apply for these programs. So in this case, if you'd like to apply for general relief or assist somebody to apply for general relief, or even review their case information or request a replacement benefits card and submit verifications, they can do so through www.MyBenefitsCalwin.org. It's our website, and what they can do is through that website, they can link the case information to MyBenefitsCalwin, which means that they can choose to receive information through MyBenefitsCalwin, whether it's the periodic reports, whether it's a request for information, a letter from the worker, anything at all. It can all be sent through MyBenefitsCalwin, and they would get it immediately. They can also choose to call the service center at 1-800-281-9799. We're accepting phone applications, If they can't do that and they'd rather fax or mail in the application, they can do that as well. When you mail the application, the envelope is provided. For general relief, individuals can fax their application to 714-825-3155. And I wanted to also touch upon another question. Does an individual have to be homeless to be eligible for GR? No, an individual, that's not one of our eligibility requirements. The individual just has to meet all of the other eligibility factors in order to be eligible for GR. And then the next question is, and if so, once they're housed, say rent a room for $200, will their general relief end? No, they will not lose their general relief benefit if they pay $200 for rent. That's not one of the eligibility requirements. We just have to make sure that they meet the entire eligibility requirements. Being homeless is not one of them, is not a requirement for GR, and they won't lose their benefits if they're renting a room. What we'd have to look at is if they rent a room, you know, maybe is income now, are they receiving income? So it'd be other things that might disqualify them, but not renting a room for $200, not typically. So we'd have to assess if you have questions or if you have an individual that has that situation, please have them call the 1-800 number and ask to speak to their worker or their representative so that somebody can review their case. But at this point, that's not one of the eligibility factors. Next. We're going to go ahead and talk about Medi-Cal. So Medi-Cal is California's Medicaid healthcare program. It's available to individuals and families who meet citizenship, immigration status, and income requirements. It pays for a variety of services such as Medi-Cal, medical, dental, prescription, and vision needs or costs. And this may be at no cost with the premium and or it's considered a share of costs. So it's somewhat of a deductible, if you will. Next. California residents within, so who's eligible? California residents within specified income limits who are children and adults, pregnant individuals, blind and disabled individuals, adults or children in a skilled nursing or intermediate care facility. Undocumented individuals may qualify for emergency and or pregnancy-related Medi-Cal. Children and young adults ages 0 through 25 receive full scope Medi-Cal regardless of immigration status, as long as other eligibility requirements are met. Next. For Medi-Cal and how to apply. Similar to everything we've told you up until now, this is for individuals and families. They all may apply online at www.mybenefitscalwin.org. Again, if they choose to link the case information, they will be able to obtain information from the worker directly without having to wait for things in the mail, or if that's their choice, they want to get everything through MyBenefitsCalwin, they can ask for that, they can get that live, they don't have to, they can reply to the individual, if perhaps it's informational data that they want to receive via MyBenefitsCalwin, that can be sent to them as well. Fax, you can fax the Medi-Cal application to 714-645-3489. You can also call the Social Services Agency call center at 800-281-9799. Currently, the hours of operation are Monday through Friday, 6:30 a.m. to 8 p.m. and Saturday, 7 a.m. to 4:30 p.m. Now, please note that these are temporarily extended hours until further notice, and this is primarily due to COVID. I believe I had a Medi-Cal question. Well, I had a question that said, are any of these services available to undocumented individuals? And so one of them is Medi-Cal. Medi-Cal does offer a restrictive benefit that is used for emergency situations, but the best thing to do is ask the individuals to apply, as they might have children in the home that could be potentially eligible for benefits. And so they should apply at www.mybenefitscalwin.org or call the 1-800 number to submit an application and receive further information regarding the programs that they're interested in applying. Next. This is covered California. Individuals, families apply for health insurance offered through the Affordable Care Act, including medical. Open enrollment period for marketplace plans. Qualifying life events can enroll at any time during the year, such as marriage, childbirth, divorce, loss of job, loss of insurance, COVID-19, and Medi-Cal enrollment is all year long. Next. Now we're talking about CalFresh. CalFresh is a state and federal nutrition program that helps eligible low-income people purchase the food they need for good health. CalFresh was previously known as food stamps. If approved, you receive an electronic benefits transfer EBT card to purchase food at local grocery stores, farmers markets, and some restaurants. Next. Now, who is eligible for CalFresh? You must be a resident of Orange County. You must be a citizen or eligible non-citizen. You must report all household members' income and property owned. Property and income limits vary depending on the number of persons in your household and their ages. Personal vehicles are not included in determining CalFresh eligibility. Effective June 1st, 2019, the CalFresh Food Assistance Program expanded to include eligible older adults with disabilities who receive supplemental security income or state supplementary payment, which is SSI SSP benefits. Next. And how do we apply for CalFresh? Again, we've mentioned it several times. We are encouraging our community to apply through MyBenefitsCalwin.org. That's at www.mybenefitscalwin.org, or in this case, for CalFresh only, it could be through www.getcalfresh.org. Individuals may also submit CalFresh applications by phone via our call center, and you can dial the 800-281-9799, or you can submit a fax. You can submit a fax application at 714-645-3489. We encourage everybody to, if you need additional assistance or you're looking for resources, I think one of the questions I had was, what other services are available for communities, undocumented individuals, et cetera. If they are not eligible for any of the programs that we have, they can also reach out to 2110C, and I believe that Susan mentioned that at the beginning of our conversation. Make sure that they reach out to them. There are food pantries, there's other information available that could possibly assist them in this time of need. Next. I want to talk about the Restaurant Meals Program. This is also known as RMP. It allows elderly, disabled, or homeless CalFresh recipients to use the CalFresh benefits to purchase prepared meals at participating restaurants by using their Golden State Advantage EBT card. RMP expands food access to qualifying CalFresh recipients who do not have a place to store or cook food, may not be able to prepare food, or lack access to a grocery store. A list of participating restaurants is available on the County of Orange Social Services Agency website. Nearly 200 Orange County restaurants are currently participating. So we're very happy that we've been able to develop this program so that we've reached that 200 number of Orange County restaurants that are listed under this program. And hopefully they provide resources for the community, as we mentioned above. Next. MyBenefitsCalwin, the website that allows you to apply for the following programs, as we've mentioned numerous times, www.mybenefitscalwin.org. CalWORKS is cash aid for families. CalFresh is eligibility or program for food stamps. Medi-Cal is medical insurance, and General Relief is temporary cash assistance for indigent adults with no children. And that's mybenefitscalwin.org. I wanted to give you some perspective. I don't think I had any more questions to answer separate from that. And so I wanted to give you a perspective. For example, in the first week of June, there's great demand in our community, and we need to make sure that you voice the resources, that you share this information with the communities. We see that in our statistics. I can share in the first week of June, for example, the call center statistics, we received nearly 17,300 calls. It was a significant increase. we see the need, the community's reaching out to us, they understand, they want to be safe. And so that's why we're making sure that they know these options, that they can apply online, that there's multiple methods of applying if they choose to do so. And now with some offices reopening, they can also choose to walk in. They'll be given the same information at the lobby, at the door. Assistance will be provided, whether it's at the site or through the phone, MyBenefitsCalwin. There's multiple resources, but please share the information with the community. Statistics on applications received. In the first week of June, we received nearly 4,750 applications. The applications for CalFresh represented over 56% of the total applications received, followed by Medi-Cal, which accounted for almost 25% of total applications received. So this is just an idea of the ongoing demand for our communities to, they're looking for assistance. So we want to make sure that you share this information with them. Next. And for additional information, please contact SSA COMM at ssa.ocgov.com or visit http://ssa.ocgov.com. Thank you very much.
Thank you, Yolanda. And next slide, please. Good morning, everyone. My name is Bernielle Timmerbias, and I'm the Senior Director of Economic Opportunity at Orange County United Way. And I'd like to thank Amber and Yolanda for providing so much useful information to help people in Orange County access all of the resources they may need during this difficult time. And also thanks to each of our presenters for clearing up some common misconceptions about these benefits. We certainly hope that today's presentation will encourage people who have never sought out these benefits to do so, maybe out of fear or uncertainty. And again, we're really appreciative to the presenters and many of their colleagues at SSA for collaborating with us on these sessions. It's been such a pleasure working with them, and we hope to collaborate again in the future. Again, if anyone has follow-up questions about today's presentation, please contact SSA COMM at ssa.ocgov.com or visit ssa.ocgov.com. And if anyone is interested in learning more about United Way and the work that we're doing to improve lives in Orange County, please check out our website at unitedwayoc.org. Also, as reference, if you need immediate assistance with basic needs, the 211 hotline is ready to connect and refer you to many services. Again, we want to thank you for joining us today, and thanks again to SSA and our expert presenters. We'll be providing a copy of the recording to all attendees and anyone that registered, and we hope everyone has a great rest of your day.